Hi, my name is Peg Meissner. I'm one of the dietitians on the clinical nutrition team at Roswell Park Cancer Institute. Today we're going to talk about nutrition for you as a cancer patient. For new cancer patients, a regimen of surgery, chemotherapy, and/or radiation is often recommended. All of these treatments may affect your appetite and your ability to eat. It is of vital importance to take in a variety of foods with naturally occurring vitamins and minerals and essential macronutrients to reduce your risk for cancer recurrence and maximize your potential for survival and improved quality of life. The macronutrients that provide you with calories are proteins, carbohydrates, and fats. These are broken down to be used as energy. Protein builds muscle, bone, skin, and blood. It helps you to conserve your muscle mass, to fight infection, and promote healing. Every gram of protein provides 4 calories. Good sources for you are beef, pork, poultry, fish, eggs, cheese, legumes, milk, yogurt, nuts, and grains. So you can see that protein comes from a lot of sources, so you should be able to find something that you like from that list. A half cup of meat has about 2 ounces or 14 grams of protein. An egg has 1 ounce or 7 grams of protein. Now, powdered whey protein, that's WHEY, is a really good source during your treatment because it can easily be added to beverages such as juice or milk. It has about 20 grams of protein per scoop, and when I say per scoop, that scoop is included in the canister of whey protein that you may purchase from a vitamin store or a grocery store. Most people need an average of about 80 grams a day, but it does vary based on your sex, your body size, and your current needs. For example, if you have a wound or if you just had surgery, you'll need more protein than normal. Carbohydrates break down into simple sugars. They're required for metabolic function and they'll give you energy. Everyone needs a minimum of 125 grams a day for brain function alone, so make sure that you're getting at least this minimum even when you don't feel well. About half your calories should come from carbohydrate. Every gram has 4 calories. Good sources are grains, fruits, milk, yogurt, legumes, and simple sugars like honey, maple syrup, table sugar. Notice that I mentioned milk, yogurt, and legumes. Also grains, they all have protein and carbohydrates. A half cup of legumes like chickpeas has 15 grams of carbohydrate and 1 ounce or 7 grams of protein. So if you can have hummus, that's a great choice where you'll get some carbohydrate and some protein. And a cup of pasta has 45 grams of carbohydrate and about 10 grams of protein, which is about 1.5 ounces. Now, fat insulates and protects your organs and your bones, and it transports the vitamins in your body. It provides 9 calories per gram, or twice as much as proteins and carbohydrates per gram. So fat is really vital if you're trying to gain weight. There are 3 types of fat: monounsaturated, polyunsaturated, and they are both liquid at room temperature. These are the first 2 fats. Those are both good for your heart. Monounsaturated are olive and flaxseed oil, so you can add olive oil to all kinds of foods, even to soups, to pastas. You can put it on bread. Flaxseed oil can be purchased in capsules. It's a little more on the expensive side, so you may want to buy the capsules. Fatty fish like salmon and herring is readily available. Herring can be bought in a can, such as kippers, or sardines, if you like that kind of thing. Very good for you. Olives and avocado are also very high in monounsaturated fat. Good polyunsaturated sources are sunflower, corn oil, and soybean oil. Most people have corn oil on their shelf, or canola oil has both poly and monounsaturated fats. So canola oil can also be added to soups or to rice, potato, or pasta dishes to try to get some extra fat in your diet. Saturated fats are solid at room temperature. They're found in animal products such as beef, whole fat milk, or what you would call vitamin D milk, cheese, eggs, butter, and coconut oil. So butter is typically solid when it sits on your table. Small amounts are okay in moderation and if you need to gain weight. So don't be afraid to add butter to your foods, even if you normally wouldn't, just so you can try to add some weight onto your body, which is vital when you're trying to fight treatments. Trans fats are chemically modified to make liquid fat into solid fat. They're harmful to your heart. Your body has absolutely no benefit from trans fats. They've been removed at this time from most processed foods, but you might still see them found on labels for baked goods or snack foods, so stay away from trans fats. Vitamins and minerals are naturally occurring in foods. They're catalysts or agents of nutrient metabolism. That means that they help you to use the protein, the carbohydrate, and the fat to your maximum advantage. In other words, if you don't have naturally occurring vitamins, you really aren't using all the other foods you're eating to help you to heal or to help you to fight your treatments. So keep that in mind when your dietitian tells you to eat your fruits and vegetables. Some examples now, B vitamins are found in grains and milk products. Vitamin E is in fats. Vitamin D is found in milk and yogurt. You can also get it from sun exposure unless your physician tells you to stay out of the sun because of some type of treatment. Vitamins A and C are found in fruits and vegetables, to name some examples. Now, B12 is an energy vitamin, which I'm sure you've heard of. It's only found in animal products. So if you're a strict vegetarian or vegan, you might need synthetic supplementation for that. Zinc and iron are also mostly found in animal products like meats. And as you know, iron is very important for energy metabolism. Some cereals are fortified with added minerals, such as instant cream of wheat. That's the cream of wheat in a packet. It does have a large amount of added iron. So eating a variety of healthy foods will help you to meet your vitamin and mineral needs in amounts that your body can process naturally. Talk to your doctor if you think you might need a vitamin or a mineral supplement while undergoing treatment. Hopefully you'll be able to get your vitamins and minerals primarily from food, and that's where your dietitian can help you to figure out how to do that. Now, water is absolutely vital for every bodily process. Everything happens in the place of water. If you have diarrhea or a poor appetite, you will likely become dehydrated. If you're dehydrated, you will be very weak, you will be constipated then as a result of the dehydration. Now, your dietitian can tell you what your personal hydration needs are. Most people need to get about 8 cups of fluid a day, but radiation and chemotherapy might increase your needs. So your radiation oncologist or your chemotherapy doctor might tell you that you need to have an excess of fluid beyond these needs. But if you're not really eating and all you're doing is drinking a lot of water, you are likely diluting your sodium and potassium in your body. So drinking an electrolyte replacement beverage will help you to feel better, such as Gatorade or Powerade. Or drinking broth for sodium, or drinking a vegetable type of a juice, like a tomato juice, which will have sodium and potassium in it. Now, phytochemicals occur naturally in fruits, vegetables, whole grains, nuts, and seeds. Phyto means plant in Greek, and that's P-H-Y-T-O. Phytochemicals provide the color, the taste, and the odor to plants. Once consumed, they affect all the chemical processes in your body, and they might help to prevent 1 in every 5 cases of cancer. That could be your case of cancer, so keep that in mind. And they help prevent diseases such as heart disease and diabetes. Research studies have shown that phytochemicals stimulate your own immune system. They block carcinogens, they reduce inflammation, they prevent damage to DNA, reduce cell damage from aging and pollution, and phytochemicals trigger the death of damaged cells that might stick around and cause cancer growth. They also help to regulate hormones such as estrogen and insulin. The American Institute for Cancer Research recommends mostly plant-based diet because the phytochemicals work most effectively with other substances in the foods where they're found. So to give you an example, when you think of an orange, you think of it as a high vitamin C source. It is. It's a great source of vitamin C, but it also has fiber, potassium, beta-carotene, and folate. Whereas if you take a vitamin C supplemental tablet, it only has vitamin C. So see what you're missing. Using supplements is less effective and could lead to overdosing. To get the greatest benefit, include a wide variety of fruits and vegetables every single day, plus whole grains and beans. During cancer treatments, consume enough calories to keep your weight stable, get enough protein to keep up your strength, and maintain your muscle mass so you can do a wide variety of activities and try to enjoy your life even during your treatments. Choose fruits and vegetables daily, but most importantly, manage your side effects of treatment. Without symptom management, it's very difficult to meet your nutritional goals. So now I'll just talk briefly about the nutrition needs related to each of the main types of cancer treatment: surgery, chemotherapy, and radiation. Before surgery, you need to increase your calories and your protein to prepare for the time before and after when you will not be eating. This is not a pleasant thought that you will not be eating, but it is an important part of the surgery. This will give you a buffer to stave off malnutrition and to keep you strong to manage the side effects of surgery. After surgery, you may not be allowed to eat right away. You might have to have a liquid diet before you get to have solid foods again. It might take days or weeks before your bowel function returns to normal, depending on the type of surgery that you have. Those surgeries that involve the gastrointestinal tract need more rest before you get to return to an oral diet. If you can't have liquids or food by mouth in the days following your surgery, you may need to get nutrition through an IV or through a feeding tube inserted into your stomach or your small intestine, and your dietitian works behind the scenes to help pick the formula that goes either in your IV or in your tube that will help to maximize your nutrition. Now, chemotherapy can cause nausea, fatigue, taste changes, a dry mouth, sore mouth, constipation or diarrhea. So what doesn't it cause? That's negative, right? But certain regimens are very predictable. Platinum-based chemotherapies often cause taste changes, and that may happen to you and it may not. Every patient is very individual as far as their response. Everyone has the potential to respond differently. So again, you need to talk to your dietitian about what your side effects are so we can help to manage them for you. Radiation to the head and neck can cause taste changes, mouth or throat pain, and changes in saliva production. Radiation to your stomach, your abdomen, or your intestines can cause nausea, vomiting, or diarrhea, and changes in your bowel habits. I think that diarrhea and constipation are already changes in your bowel habits, but keep in mind that you need to be ready for these side effects. Your dietitian can help you to manage symptoms from all of your treatments. So make sure that you consult your dietitian before, during, and after your cancer treatments as needed for guidance to help maximize your nutritional health.
Hi, I'm Lynette Regan, and in this segment, we'll be focusing on tips to help manage symptoms that can impact your ability to eat, meal planning, and food safety, as well as cancer prevention. Most cancer patients lose weight because they do not eat as much as their bodies need during treatment to rebuild normal tissue lost due to tumor, the effects of surgery, radiation, or chemotherapy. When you eat less, your body uses its own stored fat, protein, and other nutrients for energy. When you do not eat enough food, you lose lean muscle mass, increase your risk of infection, delay wound healing, lower your tolerance to therapy, and become more fatigued. If your appetite is lacking, it is best to eat small meals more often. Use a smaller plate to keep portions reasonable and enjoyable. Eat high-calorie, high-protein foods and beverages for more benefit with a smaller amount. Examples are sandwiches, protein shakes, cheese and crackers, and cereal with whole milk. Try doing some light exercise as tolerated. This may help stimulate your appetite. You should avoid foods or beverages that have an overpowering aroma. Try cool or cold selections such as cottage cheese and fruit, or a chef's salad with meat, nuts, and cheese. Should you be experiencing nausea and vomiting, be sure to take your anti-nausea medication as prescribed by your doctor. Carbohydrate foods such as crackers, toast, hot or cold cereal, rice, pasta, noodles, pudding, or tapioca are typically well tolerated. Make sure you stay well hydrated by drinking a variety of fluids, including water, fruit juices, ginger ale, popsicles, gelatin, or salty fluids like broth. If you vomit, you should wait approximately 4 hours before trying to drink liquids again. Consume small, frequent meals, emphasizing on foods that are working well for you. Diarrhea is a side effect that you may experience during treatment. Be sure to reduce your fiber intake. You should avoid raw fruits and vegetables, select cooked or canned varieties. Eat more ripe bananas and applesauce during this week. Select low-fiber grains and cereals, such as white bread, white rice, pasta, pretzels, or crackers. Avoid high-fiber cereals, whole wheat products, and foods containing nuts or seeds. Include yogurt with active cultures in your diet. These probiotics have many health benefits, such as promoting bowel regularity and lessening the symptoms of diarrhea associated with antibiotic usage or illness. Be sure to replace the fluid which you lose in diarrhea by drinking fluids throughout the day. A variety of fluids is best to help replace electrolytes lost and contribute calories to your diet. At the other end of the spectrum is constipation. Constipation is a very common side effect of when taking pain medications. Increase your daily fiber intake by eating more fruits, vegetables, whole grain products, beans, nuts, and dried fruits like raisins and prunes. Remember to increase your fluid intake when increasing your fiber intake. You may also wish to add high water content foods such as melon, grapes, mandarin oranges, or fruit and jello combinations. You may also find drinking hot beverages such as tea or coffee helps. Some people suffer from taste changes. If this happens to you, adjust seasonings and flavors in your foods to accommodate taste changes. Adding condiments such as barbecue sauce, mustard, or even salad dressing may mask off flavors. Try lollipops or hard candies to reduce persistent taste in your mouth. Brush your teeth or use mouthwash to freshen your mouth. If you are experiencing a metallic taste, try using plasticware instead of silverware and drink from a cup rather than a can. Fruit or fruit-flavored foods, such as popsicles, Italian ice, or gelatin often taste good when other items do not. Your mouth may become dry from radiation, chemo, or certain medications. Try soft, moist foods, blenderized fruits and vegetables like applesauce and very tender meats, tuna fish, or egg salad. Add broth, soup, sauce, gravy, or oil to help moisten the food. Chew gum or suck on candy to stimulate saliva. Try bland tasting foods that are room temperature. Be sure to avoid acidic and spicy foods like oranges or orange juice, tomato products, or spicy foods like chili. Some people may experience thick saliva. Try rinsing your mouth with baking soda and salt water. Mix 1 quart of water with a teaspoon of baking soda and 1 teaspoon of salt. Drink lots of fluids, gargle with ginger ale, try sour lemon or sweet foods to stimulate saliva flow. Cancer patients who maintain their weight and eat well during treatment tolerate side effects of their therapy better. You should eat foods that are high in calories and protein because you may need more than normal amounts during illness treatment and recovery. If you are unable to tolerate solid food, you may want to try liquid nutritional supplements to add calories and protein. To increase protein in the diet, try adding a protein powder to drinks, soups, sauces, casseroles, or hot cereal. you can replace water with whole milk when making canned soups, hot cereal, or hot chocolate. Add a nut butter, such as almond butter or peanut butter, to apples, celery, waffles, or toast. Adding chopped nuts or seeds to salad, cereal, yogurt, or ice cream will help increase protein. Try adding canned fish or chicken to your diet to increase protein intake. Besides increasing protein, you may also need to increase your calorie intake to help gain weight. Adding fat to your diet will help increase calories without increasing the portion size. Just 1 teaspoon of butter, margarine, or oil will add 45 calories. Use when cooking vegetables, potatoes, rice, or pasta. When possible, try using an unsaturated, heart-healthy fat like canola or olive oil. Try adding butter, honey, jam, or cream cheese to toast, bagels, or English muffins. Mayonnaise can be added in salads mixed with eggs, canned meats, or put on a sandwich. Sour cream and yogurt are good for making dip for vegetables or fruit, making gravy, or topping a potato. Meal planning is important to meet your nutrition goals. Cook meals before your treatment and freeze food in individual portions that are easy to reheat. Stock your refrigerator and cupboards with your favorite snacks and buy easy-to-prepare foods. This will help cut down on the number of times you have to leave the house to go shopping and ensure having food you like in the home. Now is a good time to ask friends and family to help with cooking, shopping, or household chores. Your immune system may become weakened while you undergo treatment. It's important to remember food safety and put it into practice every day. Wash all fruit and vegetables prior to cutting, peeling, and eating. Do not cross-contaminate. Use separate cutting boards and knives for meats and produce. Thaw meat in the refrigerator or the microwave rather than on the countertop or in the sink. Do not consume raw or undercooked meat, fish, or eggs or poultry. Be sure to check expiration dates and sell-by dates when buying and consuming foods. Promptly refrigerate leftovers and consume within 48 hours. Use a thermometer to check that food is cooked to its proper temperature. Once treatment ends, most of the side effects related to cancer treatments go away. Some may take longer than others, so be sure to talk to your healthcare providers to help manage your symptoms. The American Institute of Cancer Research suggests that cancer survivors eat healthy, be physically active, and maintain a healthy weight to help prevent or stop the development of many cancers. Here are the AICR recommendations for cancer prevention. Be as lean as possible without becoming underweight. Be physically active for at least 30 minutes every day. Avoid sugary drinks. Limit consumption of energy-dense foods, particularly processed foods, high in added sugar or low in fiber or high in fat. Eat more of a variety of vegetables, fruits, and whole grains and legumes such as beans. Limit consumption of red meat, such as beef, pork, and lamb, and avoid processed meats. If consumed at all, limit alcohol drinks to 2 for men and 1 for women a day. Limit the consumption of salty foods and foods processed with salt. Don't use supplements to protect against cancer. In conclusion, as you begin to heal and regain your strength, you will want to continue to eat a healthy diet. Look to the American Institute for Cancer Research, the USDA's website, choosemyplate.gov, and a registered dietitian to assist you in following a nutritious diet.